topic we are discussing today is why 90% of athletes return to sport too soon and how dangerous that can be.
And I'm currently working through some ACL rehab right now, making sure I hit every step of the way. I remember the first 2 weeks, like being on crutches, not being able to walk up and down stairs, do basic things like day to day that you're so used to doing, was just, I feel like a part of my identity was kind of just taken away because I had to rely on so much help from other people.
Tell me about what it really means to you to return to sport. Define that for us.
What it means to return to sport, and like it doesn't have to be just a sport, but being able to do what you love to do at 100% capacity of what you did before, if not better.
Our goal is to ultimately get you above that 90% threshold so you're confidently safe and safely returning back to sport with the strength. Welcome to the Healthcare Revolution podcast. Today we are excited to have one of our very own doctors of physical therapy with us, Caroline Vixaysack. She is so in-depth knowledge and experience on ACL return to sport. The topic we are discussing today is why 90% of athletes return to sport too soon and how dangerous that can be and how it leads to increased injury, increased risk of injury. And we really want to dive into the myths, dive into the things that really matter, and talk about the criteria that we use in our physical therapy practice to objectively measure if people are ready to return to sport. It's not a guesswork. The research is really clear, and we have thousands of articles about the objective criteria to know that you are ready to be able to return back to sport. Caroline has had specific case in her own life of her own ACL tear and recurrent injuries after that. And that's why she's so passionate about this area. And she helps her patients return back to sport safely, confidently, and with a lot of peace of mind. So we're going to talk about all things return to sport. We're going to talk about timelines, criteria, what you need to objectively measure, what you need to do in the clinics, what you need to do on the field. And all these things will really help you understand what things look like. By the time you're done with this podcast, you should be able to understand why you can't just simply Google a bunch of exercises and expect to have a full recovery. You'll be able to understand the exact stages to return to sport and what must happen with each stage. You'll be able to understand the objective criteria clinicians actually use to clear athletes rather than just time. Time is just one of the criterias. And then lastly, what questions to ask your provider, what red flags there are out there to signal to you if they're really expert level care and a good advice to return back to sport. So, Caroline, welcome to the podcast.
Thanks, Brad. Thanks for having me.
It's so good to have you here and talk about your personal experiences and really what led you to this passion. Tell us just briefly about your story and what led you to be so passionate about this area.
So I grew up playing sports. I grew up figure skating and skiing a lot, and then I went to my undergrad in athletic training. So I love the return to sport recovery of just being in the background itself. And then in PT school while skiing, I actually tore my ACL, had to go through the entire recovery process myself, and kind of just changed how I wanted to work with athletes rather than just as an overall recovery, but making sure you hit every exact phase. Because my personal recovery, I'm a better skier than I was prior towards my ACL tear, and I'm currently working through some ACL rehab right now, making sure I hit every step of the way to make sure I get back to what I love to do.
Yeah, I love that. And tell us kind of what the recovery was like with your first ACL tear. How long ago was it? What did you do? What were the steps? This was in PT school.
Yeah,
when you had
this was
happen.
in PT school, so about 4 years ago now. It was rough. I remember the first 2 weeks, like being on crutches, not being able to walk up and down stairs, do basic things like day to day that you're so used to doing, was just, I feel like a part of my identity was kind of just taken away because I had to rely on so much help from other people. It was hard, it was painful, but it was probably one of the most rewarding experiences I have gone through because it's a long recovery process. You're not working on just getting back to great. You can walk just fine, but there's stages that you have to go through to make sure you're safe to go on to X, Y, and Z on what you want to go to. So, like, the first part was rough, and then it was just long. Like, my recovery was delayed. Like, I wasn't hitting the stages as fast as I thought I would, or like what research would say. Like, we were learning about the knee when I first tore my ACL in PT school. So I was like, great, 6 months, I'll be right here. I'll be able to start running and all this. And I didn't start running until like the 9 or 10 month mark. I didn't start skiing until like the 1.5 year mark. And so I was like, I feel like I'm so behind. But like, if I just kept up the hard work, I learned the resilience of myself, which led into the resilience that I have in like my practice, helping with like patients themselves, and just through other areas of my life. So like, I love being able to do what I had to go through to help other people go through what I had to go through without mismanaging all the steps I had to figure out myself.
There's just a higher level of empathy that comes from once you've experienced it and actually helping other people through it. I mean, I've broken 34 bones, and there's nothing that helps me more to deeply connect with my patients than being in that level of pain and discomfort and uncertainty and fear and really dark times, because you feel what other people feel.
I agree. And a funny story is the surgeon actually told me, they're like, when you were on the OR table, you kept saying, this is just going to make me a better PT. Like, I'm going to have so much empathy for my patients. So I think it was funny that it translated when I was out on anesthesia, and the surgeon was like, this is all you said before the anesthesia knocked you out. So I completely agree.
So true. I remember just 3 years ago, I broke both my hands, and I literally could not unbutton my own shirt. I couldn't put my pants on. I couldn't go to the bathroom by myself. I couldn't wash my hair. My hands were so swollen I could barely move my fingers. And that was on both hands.
Yeah, that's so
and
hard.
As a therapist, I couldn't treat patients with my hands. It was a really sad time in my life.
Yeah, I can only imagine.
And when your independence is taken away and you need help from other people, it's really hard. And it makes you appreciate other people so much. And it makes you such a great therapist to walk people through that, because you walked that journey to a certain extent before.
Yeah, I agree.
Tell me about what it really means to you to return to sport. Define that for us.
What it means to return to sport. And, like, it doesn't have to be just a sport, but being able to do what you love to do at 100% capacity of what you did before, if not better, and feeling confident to being able to do it safely as well, so you don't hurt yourself doing the same thing again. I mean, accidents happen all the time. Like, I hurt my ACL again skiing because I slipped on ice. Things happen, but being able to return to it confidently and safely to the activities you want to do, that's what return to sport means. Like, making sure you're there, you're at your 100+%.
Yeah, I love that you emphasize that it's not what people think of return to athletic sports, right? We're not like return to soccer or return to figure skating. Like, not everyone in the public is a figure skater, right? Not everyone in the public identifies as a soccer or football player. We're talking all things normal life, whether it's running, whether it's playing with your grandkids, like, that's the sport we're talking about. Yeah. We're not just talking about high-level athleticism, although moms are high-level athleticism. You got to chase your kids around. You have to get down on the ground. You got to pick up toys. You got to be able to sprint in a race with your child, right? Those are the things that we're talking about today. So if that is interesting to you, that is our discussion. We're so excited to talk about this. But first, we're going to talk about why in the world you can't just Google a bunch of exercises and be effective with that. Give us some insight there.
When you Google exercises, you can for sure get ideas from the internet. However, like, you want to make sure everything is done properly and you're hitting the keystones that you need. Like, how do you personally know that you're missing quad strength or hamstring strength or like hip stability? You don't know that unless you ask advice from a professional. And how do you know if you're doing that exercise right? There's so many times I see in the gym, like, people doing a deadlift wrong or doing a lunge wrong, and they're like, well, I hurt my back doing a deadlift. Well, your form was probably really off. And even just like with myself, like, I've been working with a physical therapist myself, and they're like, well, you've been doing this particular exercise wrong your whole life. And I was like, well, that was just great insight for myself because I've been doing my own rehab while working with like another PT. But having that additional insight, making sure I'm doing something the correct way to hit the goals that I need to for that specific exercise is so important. You don't want to injure yourself again or have another injury come up because you're doing something wrong.
Yeah, and we really want to emphasize here, there's good, better, and best way to do exercises. All exercise is good, and we don't want to create a fear of movement that people are worried about. When I do a lunge, I'm doing it wrong. We really want to create security in saying we're so happy you're at the gym. Sometimes there's a more optimal way to do the movement. For example, with a deadlift, if you're not bracing your spine as you lift a heavy load from the ground, if that load is going all through your spine in a very unstable fashion instead of a really stable arm. If you're doing a lunge and you're trying to engage a certain muscle group, but your trunk is in a different position to engage the muscles that you're intending. If we're trying to target more quads or if we're trying to target more hips, you might think you're targeting a certain muscle group, but you're targeting something else, which we love that you're exercising. But if you're trying to target specific things, sometimes you don't know that you're actually targeting the wrong muscle. So if you Google a bunch of exercises for quad strengthening and you're doing it in a very particular way, you might be getting more of your hips working rather than your quad. And you might think, I've been exercising and strengthening my quad for 7 months. And you actually had very limited activation of that muscle. So it really could set you back. Our goal in therapy and to have a provider helping you is to teach you the most effective way to load certain muscles and to identify your weak points. So that way we know what to target. And then we're watching and measuring if you're actually improving in those areas, because you might be working on it for 7 months and make no improvement.
I actually have a patient who tore their ACL, did some rehab on their own, came to me 5 months later. They're like, hey, the surgeon said I'm clear to run. I started running. My knee hurts so bad. Turns out she wasn't using her quad at all, and we just made some minor adjustments in the way she was just doing some exercise. She's like, this feels so different from what I was doing before, and her strength improved just like within 20% in a month after just making really small changes. So it was awesome to see that, but I was like, if you just did this from the very beginning, you'd be so much further ahead than where you are at right now.
Yeah, absolutely. And why does really every stage require a different set of exercises?
Because every different stage you're trying to target different points. Like, say you first hurt yourself, like, you want to make sure everything is healing safely and properly. You want to make sure, like, progression of exercise, progression of rehab goes through different stages. I like to break it down in 3 stages. You've got phase 1 is let's get the mobility back. Let's get walking back. Let's get things feeling normal and healing safely. After that, you want to build up the resilience. You want to get that strength back the way that you need to, and make sure you're hitting certain parameters when you're building up that strength. And once you have adequate strength, because you need strength to do higher level activities, running, jumping, chasing your kids, picking up heavier objects from the floor, you need a basic foundation to be able to do that. And we help monitor, do you have the basic foundation for the resilience to do higher level activities that you want or need to do?
Yeah, and I love the way that you simplified that. It's kind of like beginning, mid, and end stage rehab. And even on social media, we're guilty of kind of breaking it down in those 3 phases. But if we were to really break down an ACL protocol into week 1, 2, 3, 4, 5, all the way up to 9 months, how many phases are in an ACL rehab? Not a specific number, but like how many different steps are there in an ACL rehab protocol?
Too many to count. Like, you break it down each week, you break it down each day, and it depends on the person that you have in front of you. Like, it's not a cookie cutter rehab. It depends on who's in front of you. Like, are they lacking in quad strength? Are they lacking in knee extension? Are they lacking in the ability to have balance to be able to do single-legged activities. So you're working on basic goals of, yeah, let's get full range of motion back. Let's get your quad strength and your hamstring back. Let's get you able to get to run. But what other pieces are you missing that we can help into that part that we need to get you back to?
Yep. I love the analogy of, if I was to take off my prescription glasses and give them to you, would they work?
No, they would not work.
And the same thing is with two ACL patients with an ACL tear that have had it repaired in the clinic. Say they're the exact same age, exact same sport, they're not going to get the same exercises at the same phase, right? Because every single one is customized, just like glasses that we wear every day. They're so uniquely customized to you. We have to do the same thing in rehab. Now, are there similarities? Sure. But every single person is individual, and the customized exercises for them should be individual as well.
Agreed.
Anything you'd add to that?
I think just like what Brad was saying is like, yeah, there's certain things that you need to hit as part of recovery. Like objectively, the research has shown to hit certain criteria to be able to progress from one thing to the other. But yeah, everything's customized to you. What are you missing? What do you want to return to? An ACL tear for a soccer player looks very, very different from a softball player. Even though they both require to run, what are your demands on your body? What are the demands in your life? And how can we replicate that into your exercise program personalized to you?
That's so important. We talk about in our clinic as the emotional button. We save your emotional button. An emotional button is defined as the thing that you want to get back to. What is the activity you want to be able to do by the time you're done? And it might be someone that's got some plantar fasciitis. This is a case that we're working on right now. A gal wants to get back to running. She hasn't ran in 20 years. And every time she starts to run, her foot pain comes back. Our goal is to close that gap and to say, okay, we're out of pain now, but have we met your goal? We want to make sure you're running at a high level before we let you loose on your own, because that is your goal. That's what you hope to accomplish in life. So we want to make sure to close that gap and break down phases where you can successfully do that. Because right now you just go do that on your own, your foot pain flares up. So how do we break down that barrier and build the bridge to each stage to where you're successfully jogging and then running at faster speeds and then eventually hitting your goals without pain? It can be tricky. It could be challenging. There's a lot of barriers there, but that's why we're here, is to help you with that. So tell us about this objective criteria that we use in our clinics that has been research driven to help us determine if someone is really ready to return back to sport. I like to think of this as like the big exam. You have your midterm, you have your final. Our job as PTs is to prepare you for the midterm and prepare you for the final. We don't have any say in subjectively measuring if you are ready to return to sport. Our goal is to make sure you hit every checkbox, that you've passed off every single one, because we don't want you returning back to sport unless you've literally done every single one of these things. So tell us about some of that objective criteria we use.
So some of the objective criteria is, one, range of motion, first and foremost. You want your knee bending and your knee straightening, not just like if someone were to push you into those range of motions, but like you being able to get into those range of motions by yourself, pretty equal from side to side. Like that's first and foremost. Next, you want to make sure your quad strength, your thigh strength on the front and the back, and your hamstring strength are within 75 to 95% to be able to run, jump, cut, do the things that require a lot more energy expenditure. Because if you think about it, like if you were to do a squat and then progress to a lunge and then progress to a single leg squat, hopping and running is a bunch of single leg squats really, really fast. So you've got to have the strength equal or pretty equal from side to side. And objectively, we look at that 75% from side to side for your quad and your hamstring, and having the strength from your quad to your hamstring be on both sides pretty close to that 75% chance, or 70% as well.
And I want to emphasize here that Caroline's saying 75 to 95% because there's some variation between therapists on what level you need to return. Research shows if you are returning to sport with anything less than 90, you are 50% more likely to tear your ACL again. So if you are not, your hamstring on your right, say that's the tear, if the left, or if the right is not within 10% of the strength of the left hamstring, you're 50% more likely to tear if you return back to sport. So our goal is to get you over the 90% threshold. Some therapists will allow you to return to sport at the 75% because sometimes it takes an additional 3 months to gain that, extra little bit. But our goal is to ultimately get you above that 90% threshold so you're confidently safely returning back to sport with the strength. So we talked about quad, talked about hamstring. What else we got?
We want to make sure your single leg squat testing is pretty equal from from side to side. So if you can do a single leg squats, like the same amount of on one side compared to the other side under a minute, research shows that's a great progression to be able to start running and jumping. And then beyond that, we use what's called like triple hop testing. There's 3 different kinds, but making sure you're within 10% on this triple hop testing within distance as well as within different parameters.
Break that down for us. What does it actually look like with the 10%?
Within 10% is, so say you were to hop on one leg and you're going to jump 3 times as far as you can, starting with, let's start with your uninjured leg. And you say you got 50 feet. You want to be able to hit within 10% of 50 feet on the injured leg to show that you have enough strength to be able to go on to the next phase and say like, hey, my plyometrics are good, my strength is good, my stability is good, like my knee is pretty solid to do these activities. And then on top of that, being able to be like 100% confident in whatever demands that you want in your body. So it's like, great, I passed all these tests. What's next? Like, what does that mean? Okay, well, let's mimic what your demands are, whether it's running, chasing kids, which require a lot of like back and forth. If you're returning to sport, like, can you cut on a soccer field confidently and safely? Like, let's do that in the clinic before you're out in the field. Okay, you can do it on your own. Okay, can you do it against people? Let's play soccer in the clinic. Make sure you're confident to be able to do what you want to do as well. So, yeah, you pass all the subjective criteria that is required because of research to decrease your risk of injury again. But once you get there, let's make sure you can do everything confidently in the clinic and outside the clinic as well before we leave you hanging.
Yeah, absolutely. And we're going to talk about the psychological aspect here in a minute of return to sport. But there's 2 other tests that I want to add to that. You talked about the triple leg hop, the single leg hop, lateral hops, making sure they're symmetrical side to side. We also have quad to hamstring ratio. Meaning if your quad is, say, you're able to push 100 pounds of pressure, your hamstring should be able to do 2/3 of that, so 66%. So if you're able to push 100 pounds with your quad, you should be able to pull 66 pounds with your hamstring. So we're looking at those ratios as well. So we've talked about a lot of this criteria, but in order to return to sport, time is also a portion of this. So anything less than 9 months with an ACL tear is no good. We don't let people return back to sport before 9 months. You might see some professional athletes do that. It just puts you at a higher risk. You need time and tissue healing, and the tendon actually takes time to solidify and essentially become your tendon. It's really soft at first, and you can tear it really easily. So 9 months is crucial. So 9 months, and then all the objective criteria that we've talked about, and you have to pass every single one. There's not just like a 90% pass rate and you get to pass the class. No, it's either pass or fail. We actually have a form in our clinics. It's literally a pass or fail. You don't get a 90% or an 80%. You keep coming back, and we might space out your therapy, have you work on things, but our goal is to not let people return to sport unless they've met that criteria. And we're not the bad guys. It's like, well, this is the test. This is what the research says. You get to decide if you want to return back to sport. I'm not clearing you until you've done all these things. So now that we kind of objectively looked at all those criteria, Let's talk about the psychological aspect, kind of what you were talking about. Like, are you comfortable cutting? 'Cause, there's some subjectivity to this as well.
Absolutely. I feel like there's a huge psychological aspect when it comes to return to sport. And I don't want to say this just for like an ACL tear. I feel like when it comes to any type of recovery and like returning back to what you love to do, like there's a huge mental load to get into it. Like you have a lot of fear and anxiety. Like you hurt yourself doing something and you don't want to hurt yourself again, whether it's going through to get back to something different or the same. And rehab is no easy feat. Like it is an adventure that you go on, and you're going to have ups and downs throughout the whole thing, mentally and physically. And it's totally okay to have those ups and downs, but you want to make sure, like, yeah, you're physically ready, but your mind can play such a huge role. It's like, all right, you're physically ready, but if your mind's not ready, you're going to kind of hold back. You're going to have, like, your body's going to kind of coop up in a corner, per se, and be like, well, I hurt myself doing this. I know I'm strong enough, but I don't want to try this. I actually had a soccer player I worked with years ago where she was 150%. She was doing amazing physically. Like, and in the clinic, she was doing great. However, I went to one of her soccer games, and you can just tell the hesitancy was so different with her on the field to being in the clinic. She was a completely different soccer player in the clinic compared to on the field. She was hesitant. She wasn't as aggressive. Like, she was afraid to touch the ball. And it's like, you're going to hurt yourself if you have that fear and anxiety of going into what you want to be able to do, because your body's going to end up doing different things.
And what's interesting is when we look at the older adult population, someone that has had a fall in the past, if they had a fall in the past, the number one predictor of them falling again is if they had a fall in the past. It's their fear. They've fallen, and now they're hesitant when they go down the stairs or when they go down to pick something up. It's the fear aspect that actually limits them the most. And on the field, if you are fearful to go into contact on the field, or you're fearful to do a certain activity because that's how you got hurt in the past, that is one of the highest predictors of you getting injured. So how do we work on that in the clinic? What do we do?
There's a few different ways. There's forms or outcome measures to measure like your confidence, for sure, especially with like different injuries. But making sure like we replicate that situation in the clinic to make sure you're confident. I'll talk about personal experience like right now. Like my ACL rehab, like I have the strength, I have the stability that I need to. However, I'm afraid to go to the next step because I'm afraid of what could happen to my knee. I've been told by a bunch of different people, well, this could happen. This could happen. Now I'm like, okay, well, what should I try next? So doing it in a controlled environment with someone that you trust, but also has like the knowledge to be able to look at if you're doing XYZ right. Making sure, like say it's jumping. It's making sure like you're jumping with the right form, you're landing with the right form, mimicking the environments of like what you want to get back to. Like,
what do you mean by form? How would you define that? If someone is saying, okay, I'm jumping, what is a good form and what's a bad form that we're talking about?
Good form is something stable, something where, like, let's talk about your knee. Like, your knee's not doing weird things. Your body's not doing weird things when you jump. It's not hurting.
So not landing on a limp noodle, essentially.
Exactly.
You're holding your leg super strong.
You're holding your leg. You're holding your body. Like, things look good. Things feel good. And you want to replicate that into your environment. So say you're trying to run around with your kids. Like, okay, let's have all this commotion going on in the clinic while you're running around or chasing. Bring your kids to the clinic. Are you confident chasing your kids while they're in the clinic? Great. Now we can mimic that at home because you were able to confidently do it here in a controlled environment. Now that can then translate at home, and that helps with a big, huge mental load. Like, yeah. Hey, I did it here. I can do this at home.
I really love what the objective criteria that we have in our system and what it does for gaining confidence. You could imagine if we say we did a triple leg hop test, which means that you jump 3 times on the side that's not injured and you get a distance. And then you do it on the side that was injured and you're able to actually get more distance. What does that do for the psychological mind?
It's like, heck yeah, I'm good.
Yeah,
like,
I'm confident. Yeah. And then we do it with some maybe side hops and you score the exact same thing. You're able to measure objectively when we, push, how many pounds of pressure can you push with one leg versus the other. and it's just as good, right? It develops confidence, right? And that's what we want to do, is we want to not only objectively show, like with the muscles and the stability, but we want to teach your mind that it's good as well. Because the number one predictor of you getting injured again is your fear of getting injured again. If we can overcome that and build your capacity to where that limb or that injury is better than the other side, you won't lack that confidence. You'll have that confidence to keep pushing through. So I love that. Okay, let's jump into a few rapid fire myth busters here. So number one, we love surgeons, but we hear this. If my surgeon says I'm healed and it's been long enough, am I good to play?
Yes and no. The reason why it's a yes is that means when the surgeon clears you, it means that the graft or whatever they surgically repaired is good to go. It can withstand the forces that you need. No, because you need to be able to have the function and the gait and the stability to be able to do X, Y, Z. And that's not something that the surgeon can look at. That's something more objectively as PTs that we can look at.
Yeah, if you're not getting cleared from your PT and your surgeon, we're not doing it right. On our forms, it requires 2 signatures because we want to know that the surgeon has cleared you for the graft in being solid and actually healed, and you're getting cleared from the PT for function. I love that. Okay, PT is just exercises, and I can do a lot of this at home on my own.
The answer is no. Kind of like what we talked about earlier is it's not just exercise. We're putting you through a graded process to make sure you got everything that you need to get back to what you want to do. Range of motion, mobility, manual work. Say like, okay, I've been trying to extend my knee and I just can't get it there. Well, we can use our hands to help get you there. We can use our brains and our minds to cue an exercise very specifically to target the quads if you're missing some quad strength and things like that. So, no, you can get ideas, but you need us to help you guide through it step by step.
Great. And the next one is kids bounce back faster. They don't need as much physical therapy.
I would say that's also false. While kids are more resilient, for sure, their tissues are a lot more elastic than adults. However, they still need that graded exposure to be able to return what they need to, like, to what they want to do. Like, the criteria is the same whether you're 15 or if you're 45.
That's what I love about it. It's objective.
Mm-hmm.
Our next one is rest is the best medicine after an injury.
It depends on what you mean by rest. Complete rest, like say you're shutting yourself down, no, not necessarily. But you do want to take a step back. You don't want to go from 0, like 180 to 0. You want to modify your activity so you're doing more of an active rest, like taking breaks as you need to, but you're still getting the active activity that you need. You have complete rest. There's research that shows like within, I think, 72 hours, like a bed rest, your muscles decay so fast, and it's so much easier to lose strength than it is to gain strength. So you want to make sure that strength stays up so you don't lose it all.
Yeah, it only takes a few days to lose a lot of muscle, and it takes months to gain it back, depending on what age you are. Pain-free means, when we're talking about actual injuries, pain-free means that I'm ready to return back to sport.
False. You could be pain-free. I've been pain-free my entire ACL recovery process, but I don't have the knee strength. I don't have the plyometric strength. If you have certain things could feel fine, but you want to make sure you hit the objective criteria that you need to do and that you're doing it safely, like because of healing of injured tissues, and that you're confident to be able to do that.
Great. And the last myth buster here. What's the one thing you wish every coach, you've been an athletic trainer, you've been in the fitness world, in athleticism, what's the one thing that you wish every coach, specifically in Utah, knew?
That's a great question. If there's one thing I wish every coach knew in Utah is injuries take time to heal. There's objective criteria that they need to meet, and we're on your side. Like, we want our athletes, we want you to be able to return to sport as soon and as fast as they can. We understand the athletes, it's part of their identity. We understand, like, you need them for your team, but you also don't want them to injure themselves again the very first game, because then you have to go through this whole recovery process again. we want to make sure that they are at the safest that they can be and perform at the best level that they can be. We're on your team.
Yeah, absolutely. I love that. So as we wrap up this podcast, I really kind of want to summarize a few things that we've talked about today. We've talked about how you can't just Google a bunch of exercises. I mean, you can, right? But what are we really doing? Are we really customizing care? Are we really progressing people through their next phases? We also talked about the stages of physical therapy. And there's this recipe of steps that you have to follow. And sometimes in specific order. And if we jump week to week, if we jump in the wrong order, you get the wrong exercise at the wrong time, it can have significant issues on your injury. And our goal as physical therapists is we know the recipe. And we know when there's too much butter or too much flour, and when we need to grade back a little bit. We know if we need to add more sugar, right? There's just so many things to this recipe that can change. And we need to customize it to every individual, because you as a patient have unique things that you need to get back to. And if we don't train you in those specific ways, it could really limit your ability to do all the things that you want in life. And lastly, that I'm taking from this is the importance of, if you do have an ACL injury or any type of injury, the importance of having objective criteria. It's easy for any medical provider to say, you look good. It's been time. You're good to return back to sport. Whether it be an ACL injury, whether it be you're coming back from a baby, having a baby, postpartum, there is objective criteria to help us to understand if you're truly ready and that you're at increased risk for injury. We don't want that. You literally are coming out of a hard time, and we want you to succeed and not have injury. And that's why we've created objective criteria to help you bridge that gap. So any other big key takeaways that you hope our listeners have really caught today, Caroline?
I think if you're working with anyone, like coming back from any injury, make sure they're using the objective data to get you back. Like, great, you're pain-free, you're good to go. Reevaluate who you're working with and making sure like, okay, you've hit this objective data, things are looking good, and make sure your care is very personalized, and it's not just cookie cutter. Like, okay, this person has back pain, I'm doing the same exercises as this person. Are they for the same reason? Like, question your healthcare provider, making sure, like, or PT or chiropractor, whoever you're working with. Like, why am I doing this, and how does it relate to me? They should be able to answer that question 100% of the time. And if they can't answer the question, you got to reevaluate who you're seeing.
Yeah, I love that you talk about the importance of education and you understanding why I'm doing this specific thing. If you're just getting a list of exercises and you don't know why you're doing those exercises, ask the question, because that's something that you need to understand. Because if you don't understand why you're doing the exercises, the likelihood of you actually doing it is pretty minimal. Tell us, what do you hope that our listeners, if they listen to this podcast, what are you hoping they actually do?
I want you to think about where you're at in your journey of recovery. And are you at 100%? And if you're not at 100%, come find us. We're going to help you. Let's get you to 100%.
And it's so fun because, a lot of people have 3 to 4 things that bug them, and they never really do anything about it. And they don't know the value that a good physical therapist can create in their life. We just work through those injuries. Yeah. And sure, it takes time, it takes energy, but imagine the quality of your life if you worked through every one of those things. I have a friend that's coming to me right now with some shoulder pain. He's had some shoulder pain for, 6 or 7 years. Every time he does a specific movement, it just hurts. So he just avoids those movements, and he's fine. But it's not doing the things that he wants to do. He wants to do a higher level activity. Mm-hmm. But it's holding him back, and it's holding you back from the things that you want to do the most. So get a good physical therapist in your corner. We are now direct access. We're now primary care, and it can really just help you live the life you always wanted. That's what we do here at Foundation. That's what every physical therapist does, is help you get back to those things that you love. So as we wrap up this podcast, kind of with our final message today, what do you want every athlete, every parent, every coach, Anything additional that you'd add to someone that's had a serious injury? What advice?
The advice I would have is find a physical therapist in your corner, and find someone in your corner and know that we are part of your team. Like, we want to get you back to 100%. We care about you 100%. There's times where it'll eat us at night sometimes where it's like, oh, they're not doing as good as I want them to, but we care about you and we want you to succeed.
Yeah. And that's a good way to end this, is we really want the best for you.
Yeah.
And we want the best for society. Society suffers way too much with pain. And that's something that we specialize in, is helping people get back to the activities that they love pain-free.
I agree.
So Caroline, thank you for your thoughts today. Thank you for what you do for our community and the care you bring every patient. Makes a meaningful difference.
Thanks, Brad. I appreciate it.